Oh, this couple consulted me today itself in the morning, and she's a little plumpish lady with her body weight of about 72 kg, and she's been trying for pregnancy for last 7 years. And everywhere, whenever she has consulted any doctor, everybody's telling her to reduce weight, which is rightly so. But believe me, increased weight and a difficulty in reduction of weight is very, very common. It's a kind of an eating disorder. It's a psychological situation wherein whenever you tell them to reduce weight, it's very difficult for them to follow the regimen unless they develop that willingness right in the center. So what we went ahead is we said, okay, even if you don't reduce weight, doesn't mean you don't have your chance of pregnancy. You will still be able to have a chance of pregnancy, but we'll be taking some risks and we have to alter our therapies in such a fashion that you can get a faster pregnancy even at this weight. But she was thrilled. But I said, reduction of weight cannot be just shunned away. And during the course of treatment, you cannot increase another 5 kgs and become 76 or 77 kg. That will spoil the pregnancy outcome further. So let's continue with reduction of weight. So we gave her a very nice diet plan, and a cognitive behavioral therapy was started, wherein she consults us every 10 days on a video, and our dietitians work on her diet slowly and steadily, making one change at a time, encouraging her continuously. So she sheds off about maybe a kg in a month, but that's all okay. Because the moment even a small weight comes down, the sex hormone binding globulin increases, which binds to all bad hormones, and your hormonal purity of the body improves. To get a faster pregnancy, we shifted her to gonadotropin regimen, that is giving injections to develop an egg. Because all that time, 6 and 7 years, she was struggling with taking simple medicines like clomiphene and letrozole. In a lady who is obese, only clomiphene and letrozole will take an ample amount of time. It will not act very fast. So we shifted her to gonadotropins, wherein we are giving HMG injections to her with a good dose over 150 IU, giving about 6 or 7 injections she received in a particular cycle. And trust me, in the very second cycle, she had a spontaneous pregnancy. Now, with that encouragement, she was thrilled. She said, Doctor, you told me that during pregnancy I will gain another 10 kg. But now I'm enthused. Tell me now how I cannot gain a lot of weight in pregnancy. And then we gave her a complete diet regimen which consisted of very low carbohydrate diet, a good amount of protein, or taking healthy carbohydrates like tomatoes and carrots, etc. And definitely now through the pregnancy, she's not going to gain a huge amount of weight. She's all enthused. Her eating disorder has disappeared and she can get a good pregnancy. My conclusion here is, just because you are heavyweight and you are not able to reduce doesn't mean that you have to go through that typical orthodox cycle of weight reduction and then only chasing pregnancy. Agreed, weight reduction a fantastic good practice point. But having a heavy weight is a psychological situation. It's a dysphoric disorder, and we need to crack it up by giving a little heavy therapy, by giving gonadotropins and getting a pregnancy faster. Thank you.